Hi everyone, it's me, Dr. Whimsy, and today we are talking about intermittent fasting. A lot of people have been talking to me about it. I know it's very popular in people who are professional athletes or who are very concerned about gaining weight, losing muscle mass, and they just want to take their health to the next level. So intermittent fasting, I just want to talk a little bit about what it is, what the claims are, and whether or not there's any science to any of it. So what exactly is intermittent fasting? Intermittent fasting is the idea that you go a specific amount of time throughout the day without eating for at least 12 to 13 hours. If you're doing more than 12 hours, if you're taking more than a 12-hour break from eating, then you can say it's an intermittent fast. Some people go 13 hours. Some people go even longer, where they only have an 8-hour window where they allow themselves permission to eat, and then the rest of the time they fast. So that is basically the definition of intermittent fasting, where if you're doing the 8 hours where you're allowed to eat, then that would mean you go 16 hours without eating. So say, for example, your last meal is 4 or 5 in the afternoon. You wouldn't eat again until the following day. You do the math. Maybe 10 in the morning, 11, I don't know. So that's the story with intermittent fasting. Okay, so here are the claims that I found online. Claims that you would have increased muscle mass if you did this, that you would decrease your body fat, that you would have enhanced athletic performance and longevity. There was also a claim of reduced risk for cancer. All right, so what are the facts versus fiction? Well, the facts are that there have not been large studies on intermittent fasting, but there have been small studies on intermittent fasting, and the research on those small studies using small samples, small groups of people, are actually pretty compelling and pretty impressive. So I'll go over those now. There was a women's health study where they had women fasting for 13 hours. And they actually found some interesting things in that population. They did see a reduced risk for breast cancer for people who may feel like they are at higher risk for breast cancer. There was a correlation with that. On a side note, people who are undergoing chemotherapy, cancer patients, for example, if you had breast cancer and you were undergoing chemotherapy, there's some research that has shown that fasting during the times you receive the chemo, having reduced or calorie restriction during the time of receiving chemo, made the chemo more effective. And that is because the metabolism dropped, whereas the metabolism of the cancer cells did not, and it just allows the theory is that it allows the chemotherapy to target those cancer cells more effectively. So I am aware that some doctors recommend calorie restriction or intermittent fasting at the time when a person is receiving chemotherapy. It also may help with other things as well. But this study didn't look at chemotherapy. This was a study that was looking at whether or not cancer risk were reduced. And it did in fact show in the women's study that there was a decrease in the risk for breast cancer in women that fasted for 13 hours or longer. But again, these are small sample sizes we're talking about. There was also stabilization of the blood sugar that was found in that population, and insulin levels were more stable. This led to some side studies trying to find out if there was a correlation between blood sugar dysregulation, insulin levels, and increased risk for breast cancer. Putting genetics aside, what does stabilizing the blood sugar and keeping insulin levels stable have to do with whether or not you have an increased risk for breast cancer? So I thought that was kind of interesting. The studies also showed that intermittent fasting can drop blood pressure as well, sometimes as much as 4%, and that can be significant, particularly in populations where you're right at the border between high blood pressure and normal. That window we start to see where the systolic is at 135, diastolic 80 and above. If you're between, say, 140, 145 and 80, 85, and say 135 and 80, that's the real window when we start to talk to the patient about taking medication to lower blood pressure. If you can get that blood pressure dropped by 4% because of intermittent fasting, you might want to talk to your doctor about that, because that may be the difference between having to go on medication and being able to either reduce or not have to take medication. And finally, there were studies in athletes that were doing resistance training that showed that those athletes, those people that were doing resistance training along with intermittent fasting seemed to have to gain more muscle mass. And that was not with professional athletes. I think that was simply in people that were doing resistance training. The last thing I would say about intermittent fasting is that not everybody should do it. You certainly want to talk to your doctor and get the okay from your doctor before you start any program like this. But specifically, I would call out if a person were coming to my office and wanting me to put them on a protocol for intermittent fasting, these are some of the people that I would probably not want to put on intermittent fasting. And that would be people who are diabetic, insulin dependent. You don't want to mess with intermittent fasting. You really want to make sure that you're monitoring your glucose levels throughout the day, and you don't want to mess with something like this. Then I would definitely also recommend anybody who's on a strict diet protocol from their doctors. Again, you don't want to be messing with this. You really want to talk to your doctor before you start experimenting with intermittent fasting. Patients who are on multiple medications, particularly medications that have to be taken with food, again, probably not the best candidate. People with a history of mental health challenges and eating disorders, I would not place them on intermittent fasting because it can trigger stress, which can add to problems they may already have with an eating disorder. All right, so I'm going to go ahead and link everything I have below if you'd like to read the studies that I was able to find that were based on the actual human studies. Again, I want to point out that these are few and far between. There aren't a lot of studies, but I will say that the research is pretty compelling and I think it's interesting. I do know some people personally that are doing it and they swear by it, but there you have it. That's the data that I could find on intermittent fasting. Like every thing that I cover here on my channel, I strongly encourage you to speak to your doctor before making any changes to your diet or lifestyle. I want to thank you for listening. Be sure and share, like, subscribe, and I look forward to speaking to you again. Take care. Bye-bye.